right, so we're about to be live in a few minutes. I think we are now. All right, you can start, Carol.
Okay, well, good evening, everyone, and welcome to NCNW Fayetteville Area Section webinar. Tonight, well, let's just open up with a prayer. Can I get, Madam President, would you uh, say a prayer for us?
Yes, ma'am. All right, dear Heavenly Father, we gathered here, one, just to tell you thank you for allowing us to see another day, God. Thank you for allowing us to see another year. God, we just thank you for keeping us safe as we slumber and slept, God, with everything that's going on in this world, God. You put your hedge around us, God, of safety. Lord, we just ask for those who are coming in to keep them safe, God, and just allow this to be a productive and wonderful and informational webinar. I hope this helps someone, Lord. And I speak, God, just ask for you to give her the right words to say, God, and give her the information that we need. In Jesus' name we pray. Amen.
Amen. Amen. And thank you so much for that prayer. This webinar is hosted by our Health Equity Committee. And so tonight we have none other than Dr. Robin Peace from Lumberton, North Carolina. She wants to do her own introduction. So I'm going to turn the floor over to Dr. Peace so she can introduce herself.
Good evening, everyone. It is a pleasure to join all of you ladies this evening to talk about women's health, wellness. I'm actually from Oxford, Granville County. I have a family member that's on with us this evening, and I try to promote this because I can't be everyone's doctor, but I can certainly do things like this so that my message of wellness is shared to those who are not even my patients. So I'm a family physician. I've been practicing medicine now in Robinson County, going on 27 years. If I include my residency, I've been practicing medicine for 30 years. And so I feel like an expert in taking care of patients in this community. And as many of you know, Robinson County is one of the sickest counties in the state. So, I'm taking care of sick people. And the older that I get, the longer I practice medicine, I feel like it's a ministry, what I'm doing for the patients that I serve. God has blessed me to do this work. I'm grateful for every opportunity. And I really just want us to learn together. I mean, a lot of the things that I will share, it's not just things that I've studied. It's my patients. They teach me. We teach each other. So I want this time that we spend this evening to be a learning opportunity for both of us. And I do pray that something is said that if it can't help you personally, that you will be able to share it with someone in your circle so that we can all just be healthier. I mean, we can't stay here forever. None of us are going to live forever, but I'm trying to help educate people and really empower people to make choices that will allow them to live longer, productive lives. And if you are a Christian as I am, so that you can serve God and God's people. It's hard to serve when you're sick. And so we want to stay as well as long as possible. So with that being said, I don't know what else I want to tell you about my background. I did go to undergrad at Carolina. So, I am a Tar Heel, even though we've been struggling this season playing basketball. I went to medical school at East Carolina in Greenville, North Carolina, and I trained there. And so I spent 7 years in Greenville, and then I came to Lumberton in Robinson County. And this is the only place I've practiced medicine outside of my residency training. And I'm just grateful. I'm grateful that God has kept me here. I have stayed in this community because I feel like I'm making a difference. The community has embraced me, and I feel obligated to do things like this to try to help encourage people to make healthier choices. So with that said, you know, there's a lot of things that I kind of want to share, and there may be things that I shared with you guys last year. But, you know, the thing is even hearing things over and over again, sometimes you don't get, you know, you never know when the light will go off and all of a sudden, you know, something that you didn't think that you could overcome or a change that you could make that would allow you or your family to be healthier, and then it happens. So I want to talk about a prescription for wellness. You know, that is kind of the framework of what I'm going to talk about. And we're going to talk about a lot of things. Yes, I have referred to myself as a preacher of health. I did put that on my bio, but I'm also a servant of the great physician. But I've been accused of preaching to people. And sometimes I've been accused of being hard, but it is in the name of caring. I do care. And so I want people to be healthier. I hate seeing people suffer. And so with that said, we're going to start. The first thing that I want to talk about, you know, when I was thinking about all the things that I wanted to share, you know, and we're going to be talking about things that affect not only our mind, our body, and our spirit. The number one thing on my list that I want to start with this evening is the importance of adequate sleep, ladies. Okay, because if you do not get adequate sleep, that spills over into your total well-being. A sleep-deprived person doesn't have as much energy. You know, a lot of the complaints I hear in my office is, I'm tired. I'm so tired. Well, if you're not getting quality sleep, then you're going to be tired. And there are many things that we do that affect our ability to get a good night's sleep. You know, our lifestyle habits, what we are eating, what we're drinking, the time of the day that we're eating and drinking will play into whether or not we get adequate sleep. Our devices, these keep people up at night. Okay, we looking at Facebook and social media. We have the television on. It is not a quiet, dark space. So this is all called sleep hygiene. It is so important. People that don't get adequate sleep, they're more likely to increase their risk of heart disease. You know, I don't think that's something that's widely known. You not getting adequate sleep could increase your risk of having a heart attack. And a heart attack or heart disease is still the number one thing that kills people in our country. So it is so important. There are some people that are not getting quality sleep because they have sleep apnea. That is something that goes undiagnosed a lot. And so if you are having severe, excessive daytime sleepiness, it may be that you have sleep apnea, and that is something that you should inquire about. One of the things that I really want to drive home this evening is to empower you to ask your medical provider about something that maybe they haven't offered you. Okay, you know, there are a lot of things that we need to fit into a 15, 20-minute, 30-minute office visit. And sometimes there are things that aren't offered to patients. I want to make sure that you can write down some things that maybe your medical provider hasn't mentioned. If it sounds like it may be something that you're dealing with and you need to get checked for, that you can bring it up. I want to empower you to do so. There should not be a medical provider that is not open to listening to a suggestion about something that you want to be screened for or something that you want to be checked for. So adequate sleep, it is so important. The second thing on my list to mention, and just because I talk about things and move on, it doesn't mean that we can't swing back. And I do want this to be interactive. I want you to ask questions. I want you to put them in the chat if you have questions, and we will answer as many as possible. I don't want to just have people to stop me to ask the question this time, because I want to make sure that I get through and highlight all of the things that's on my heart to share this evening. So what I want to say about nutrition, ladies, is that we are as healthy as what we choose to eat. You know, we all make choices about what we're going to eat, how much we're going to eat, when we're going to eat, but it does play into how you feel. And I would think that every person listening to me this evening, you want to feel as good as possible. You want to have as much energy as possible. You don't want to hurt in your body. You want to be able to move and do all the things that you want to do in a given day. Well, what you choose to eat, it directly affects how you feel. And we should all be eating real food. That's what I call it. You know, what's a healthy diet? It's real food. What's real food? Real food is whole foods. What is whole food? Whole foods are things that are not processed. They are things that have one word: chicken, eggs, beans, you know, things that when you look at the ingredients, that you don't see a long list of words that you can't pronounce. Okay, those things are processed, and processed food leads to sickness and disease. We are so sick as a country because of what we choose to eat. And we do have choices. You know, one of the things that I remember from last year is someone brought up the fact that eating healthy can be expensive. Well, guess what? Everything is expensive this day and time, right? And so we have to be creative. We have to budget. We have to start cooking. You know, one of the things that surprises me in some of the younger patients that I see is their inability to be able to cook. You know, that's one of the things that those of us that are over 50, it's not a whole lot of people over 50 years old that don't know how to cook. You know, you learn how to cook over time, but we need to be teaching our children how to cook something that they want to eat. Because when you eat in a restaurant all the time, that you don't know what's in that food. You don't know what they put in it. And so it can't be as healthy as something that you're going to prepare at home. And we are all busy. You know, we have busy careers. Many of us are caregivers. You know, some of us have children, grandchildren, extended family that is pulling at our time. And I do get that. But we have to make eating a balanced, nutritious diet. We have to prioritize that. If you don't try to eat healthier, then you won't. You know, just like with physical activity, if you don't try to figure out when to fit in regular physical activity, then you won't. You know, one of the most unhealthiest things that I think people can put in their mouth and consume, and people have heard me say it before, but, you know, I'm going to keep saying it, and that is drinking sodas, okay? Drinking sodas are processed, okay? Diet sodas are processed. Clear sodas are processed. All sodas are processed, and they are one of the most unhealthiest things that we can consume, but yet it is a billion-dollar industry. There are many of us that we drink sodas, 2, 3, 4, 5 sodas a day. I had a couple, they told me they drink a case of sodas between them every couple of days. There are a lot of consumption of soft drinks. It is one of the reasons why so many people are suffering with uncontrolled diabetes and continuing to have trouble gaining weight. You can not eat a whole lot and drink a lot of sodas, and those calories will keep the weight and keep you gaining weight. So you really should consider that. And it does give you energy. I realize it. You know, people that are consuming them, they're tired, they're trying to get going. I try to encourage people to get their caffeine if they need caffeine, to try to get it from coffee. You know, learn to drink it. You know, you may say, well, I don't like coffee. I can't drink black coffee. Even if you put cream and sugar in your coffee, that's better than a processed soda. That's made in a plant. You're adding the cream and the sugar to that. So what do I drink other than black coffee? I drink apple juice. Apple juice is something I can get 100% apple juice. It doesn't give me heartburn like orange juice does at times. And so, I offer that up. That's in addition to water, because not a whole lot of people are drinking as much water as their body wants them to drink. Some of the fatigue that I see, particularly in the summer months, it comes from people just being dehydrated. A lot of the blood pressure medicines that people take are diuretics or fluid pills. And so that's going to make you urinate more. And you have to replace that with water. Caffeine is a diuretic. So if you are consuming caffeinated beverages, whether it's sodas or tea or coffee, that's making you urinate more. Some of the overactive bladder, that's a common symptom that I see in women, is because the caffeine and the carbonation in soft drinks is irritating your bladder, ladies. And that is why you're getting up multiple times, sometimes to go to the bathroom, because your bladder's irritated from what you're putting in it. What you put in or don't put in your body is a direct result of how you feel. I cannot say it enough. And so, again, the sodas, fast food, if fast food industry was dependent upon people that thought like me, they would go out of business, because, it is convenient, it's quick, but burgers and fries is one of the most unhealthiest things that you can consume, particularly when you're going to a fast food restaurant to get it. If I eat a hamburger, I'm making it myself at home, because I want to know what the hamburger meat looks like before I cook it and put it in my body. Same thing with the fries. I'm making my own fries as opposed to getting them at a fast food restaurant. And there are healthier options at fast food restaurants, but guess what? People don't go to fast food restaurants for grilled chicken sandwiches, and they're not getting those. They're getting the burgers and the fries. So I want to encourage you to think about that as well. But it's the processed foods that are the most unhealthiest. Processed meats. Bacon is processed, ladies. Hot dogs is processed. Cold cut meats are processed. It's the processed things that lead to the most sickness and disease that I see in people, and what we snack on. I love to snack on hummus. I love to snack on popcorn, cheese, not processed cheese, but cheese. All those things are good snacks. Fruit is a great snack to snack on. I love dunking apple slices in peanut butter. I think that's a great source of protein, and it's good, so you can have things that are good, that are tasty to you, that are just healthier. And when you eat whole foods like that, then you have more energy, your digestion is better. One of the things that I have noticed when I have gone through spiritual fasting, when I cut out meat and I'm only consuming beans and fruit and vegetables and things that are grown from the earth, my digestion is better. So for you that are struggling with constipation or bloating, I encourage you to think about your diet and how you can change it so that you can help that situation naturally. I love to try to encourage people to fix their ailments in a natural way, so that you don't have to take a pill. I mean, there is a place for prescription medications, but a lot of the prescriptions that people are going to get, they don't need them if they change their eating habits and they change how much water they consume and they get adequate sleep and they get adequate physical activity, which is the third thing on my list, is encouraging you ladies to get some kind of routine of exercise. Regardless of whatever your state of health is, you could be doing something. A lot of the pain that people have in their bodies is because they are not moving appropriately. They're not stretching. They're not doing muscle strengthening exercises so that you can continue to do things like this, some light hand weights. You can do chair exercises. You can join a gym and do something there. You can pull up on YouTube. If you're looking at me right now, then you probably have the ability to project YouTube on your television so that you can pull up chair exercises or muscle strengthening for your upper and lower body so that you don't get so stiff that you hurt. Someone said something about chair yoga. I love yoga. Okay. I do yoga sometimes 5 times a week. I have a yoga studio that I go to here in Lumberton. It's called Love Yoga 333. And, you know, it has been the most meaningful thing or change that I have committed to in the last couple of years that serves my mind, my body, and my spirit. I pray during my yoga session. You know, I'm stretching, I'm breathing. You know, it helps to relax me. It helps me manage my stress. It's stretching my muscles. It is such a great way to start your day. Just like we start day with devotion or we start with prayer, doing yoga is a great way. If you have never tried to do yoga, I want to encourage everyone that is listening to me to give it a try. It's not for everybody, but the practice of yoga is medicine for your mind, your body, and your spirit. And so I want to encourage that in you today. And as far as the physical activity goes, again, some of the sleep disturbance that people have, I feel like they don't exert themselves enough. Okay. And for those of you ladies that are retired, you have no excuse. You got all day to figure out something. It could be a brisk walk. It could be, you know, getting on a stationary bike or an elliptical machine at a fitness center. But again, it could be something that you do in the privacy of your home. But I promise you, as I have watched people age over the last almost 30 years in Robeson County, the ones that go into their 60s and 70s and 80s and beyond are the ones that subscribe to regular physical activity. You can't just say, oh, I'm going to exercise here and there. You need to commit to doing it 3 days a week, 4 days a week, 5 days a week. You may not achieve it every week, but if your goal is 5 days a week, then prayerfully you'll get in 3 days a week. And there is no downside to exercising, you know, unless you pull something and you injure yourself. You listen to your body. If you haven't been exercising at all, you don't go from not doing anything to trying to walk 3 miles in one day. Baby steps. You build up to it, you know, and you don't allow just because you're not where someone else is, you know, don't let that keep you from going to the gym, you know, because there is something to the social interaction that you get being around other people. When I was told that I couldn't run anymore and I asked my neurosurgeon what I could do, the first thing he said, well, you can walk, Robin. I said, walk? You know, I mean, I tell my 80-year-olds to walk, you know, walking by myself, that's boring to me. But if I'm walking with a friend, then I can do that, you know. So I encourage the social connection with the exercise. And you do need to be consistent when you are exercising in order to see the results. Because one of the things related to nutrition and physical activity goes back to the weight. And just as sure as I'm sitting here, you know, there are those of you that you want to lose weight. You know, there may be some of you that are hoping that we talk about things to help you lose weight. And that's certainly something that I want to address because it's real popular right now. You know, we have a lot of other options to help people lose weight. And being overweight, really overweight, it is a chronic medical problem. You know, I see my severely overweight patients I see that as a chronic problem, just like their high blood pressure is a chronic problem, just like their diabetes is a chronic problem. So I aggressively want to help the patients that I serve to lose the weight that they want. Because guess what? When you lose meaningful weight and keep it off, all these other things like high blood pressure, diabetes, arthritis pain, cholesterol, those things tend to get better with weight loss. Even sleep apnea can get better or even cured with enough weight loss. So those things are important. As far as the physical activity goes, I can't stress it enough, because it is something, regardless of whether or not you're overweight, that you need to do. Every person needs to do that. And it's just a matter of you finding what fits your lifestyle right now. And I'll pause and I'll go into just talking about some of these weight loss drugs. So, I'm sure that all of you have seen the commercials about drugs like Ozempic, Wegovy. Wegovy and Ozempic, those are the same two drugs. One, Ozempic is indicated for diabetes. When they got the indication for weight loss, they had to name it something different. And so that's called Wegovy. It's the same drug. Okay, ladies. Mounjaro is for diabetes. Zepbound is for weight loss. It's the same drug. I think that these drugs are the best thing that has come on the market for the treatment of type 2 diabetes and to help people lose meaningful weight loss. Let me just say that. Now, that said, they're not for everyone, okay? Everyone can't take these drugs. Sometimes people get started on them and they get nausea so bad, even on lower doses or vomiting, that they can't take it. Some people have such severe changes in their bowel habits that they can't take it. But by and large, they're well tolerated, and there are very few contraindications to taking it. The challenge is getting your insurance to help pay for it, because without insurance coverage, they're just not affordable. Okay. And I want every person, every type 2 diabetic person, every obese person that wants to lose weight, I want you to have access to it. This past year, Medicaid, North Carolina Medicaid, pays for Wegovy in a lot of patients. Okay. So it's just a matter of time until your commercial insurance, until your Medicare prescription plan, it is a matter of time before they will be covered. Okay. So if you've tried and you weren't able to get it, try not to get too discouraged. I think there will come a time, and it may be as soon as in the next year or so, where most people that want to take and try these drugs, they will be able to get it. It is important, though, that you know that you have to manage the side effects. So what I tell my patients when I prescribe these drugs for diabetes or weight loss is that it will likely change your appetite for food. Okay, so it slows down everything going through your system. It literally kind of the food stays in your stomach longer. So you may feel full faster. And if you eat beyond feeling full, you're likely to get nauseated. You may even throw it up. It is a deterrent to overeating. Also, you can have changes in your bowel habits, either constipation or diarrhea. Okay. And most people, it's constipation they have to manage. A lot of people that have constipation, they have it before they take these drugs because they're not eating enough fiber or they're not drinking enough water. And so if you add on a prescription medicine that has a side effect of constipation, it's not a stretch to know that might make that issue worse for you. So keep that in mind before you start taking these drugs, and ask your provider how you can manage that so that you can be successful. I want you to be successful. Annual wellness visit. Okay. I don't care how well you think you are. Every single person needs to go to the doctor once a year. Even if you don't have any medical problems, you don't take any medications, I think every single adult person should have a trip to a medical provider for a wellness exam. During that exam, you're getting screened for diabetes, for high blood pressure. You're getting your weight checked. You're getting wellness labs to check your kidney function, to check your cholesterol. And you're getting updates on vaccines. That's one of the things that I talk to patients about a lot more during their wellness exam. We're in flu season, ladies. Just 2 weeks ago, I was home all week with influenza B. I did have my flu shot. I think that because I got vaccinated for influenza, that the case of flu that I did have, it wasn't as severe. Despite not being really sick, I still took Tamiflu, which is the antiviral that you can take if you get diagnosed with influenza. There have been over 300 people that have died from the flu in our state this year. So the flu still does, it's still a very significant virus in our community. And so even if you haven't had a flu vaccine yet, I'm still giving them. We're still encouraging people to get them. I know that there's a lot of different opinions about vaccines right now. There are people that they subscribe to them, and there are people at the other end of the spectrum, and they don't get any. And I have patients at both ends, but I'm still offering them. I'm still encouraging them. I'm still encouraging COVID boosters, or COVID vaccines rather. I got my last COVID vaccine in September. I'm still encouraging people to do that. For the RSV vaccine, that generally is for people greater than 75 years old. But if you're high risk and you're over the age of 60, that may be appropriate for you. That's a one-time vaccine. There's a pneumonia vaccine that for high-risk people, you may be offered that even at the age of 50. But if you're otherwise well, you may not be offered that until you're 65. People that are 65 and older, no matter how healthy you are, we're encouraging you to talk to your medical provider about the pneumonia vaccine, which protects against a bacterial pneumonia that you can just pick up being out in the community. I've had patients over my career that they died from that type of pneumonia. And so the best way to combat things like flu and measles, because that's been in the news, as well as COVID, is to be vaccinated to try to help prevent it. Some people react to vaccines just like some people react to medications, right? So I don't see, it's interesting to me that people are so not concerned about the GLPs, which are these injections to lose weight. They're all for that. So even patients that they wouldn't hear about taking the COVID vaccine, they want that shot to help them lose weight, so it just depends on what you want, right? So for me, I want to encourage all of you to look into the vaccines that are currently offered. Shingles, I will say, I'm 57. Shingles recommended 50 and older. I have yet to get it. It's not because I don't think that we all should, that are over the age of 50. I just honestly haven't taken the time to go to like a Walgreens or a pharmacy to get it. It's 2 vaccines. You get one, and then 2 months later, you get the second one. I see several cases of really bad shingles every year. And sometimes the pain that's associated with shingles, it never goes away, ever. And I have patients that they take chronic pain medications because of the severity of the pain that they have from having shingles. And I have never seen a patient that got shingles after they had the Shingrix, which is the most up-to-date shingles vaccine. During your health visits, when you get your blood work, I want to make sure that you are aware of certain numbers. Okay, ladies? A normal blood pressure is less than 120 over 80. Less than. Okay? A lot of the people that I see in my community, they've never seen a blood pressure that low. Okay? You might go to the doctor and you get your blood pressure checked and you ask the nurse, how's my blood pressure? And it's 135 over 85. And they say that's good. Well, it is good, but it ain't normal. It's not great. Great is the best. And the best is less than 120 over 80. Okay? And the lower your blood pressure, the lower your risk of cardiovascular disease. The lower your blood pressure, the lower your risk of chronic kidney disease. There's a lot of chronic kidney disease in my community. Every single one of you that are listening to me, you need to know what your GFR is. You don't necessarily need to know what it stands for. It stands for glomerular filtration rate, but it's GFR. GFR, that is a number that is the calculation of how well your kidneys function. If you have someone in your family that had dialysis or has chronic kidney disease, especially if it's a mother, father, brother, sister, that increases the likelihood that that could knock on your door. A normal GFR is greater than 90. Anything less than that is not normal. When it gets below 60, that is stage 3 chronic kidney disease. Between 30 and 60 is stage 3 chronic kidney disease. Stage 5 is when they talk to you about dialysis, putting you on dialysis, okay? And so you want to know what that number is, especially if you have high blood pressure or diabetes. You want to know what that kidney function number is, because if it's trending down, then you need to be talking to your medical provider about what you can do, things that you can do to help keep it from getting lower. Because I don't have to ask. I know everybody on this webinar wants their kidneys to last their whole lifetime, okay? Mm-hmm. So know what the number is so that you can address it, so that you don't take anything that may further hurt your kidneys. Things like Advil, ibuprofen, Aleve, things that we can get over the counter for pain and arthritis. If you're taking those things every single day and you already have chronic kidney disease or your GFR is not greater than 90, that could cause your kidneys to get worse over time. It's really important. So everyone ought to know what that number is, just like everyone ought to know what their A1C is. The A1C test is a test that tests you for pre-diabetes or diabetes. A normal A1C is less than 5.7. Between 5.7 and 6.4, that's pre-diabetes. Up until my blood work this year, for the last 4 or 5 years, I have been pre-diabetic. Ladies, if I can be pre-diabetic, every last one of y'all could be pre-diabetic. And maybe the only reason why you don't know is because your provider has never checked that test. I routinely check it now because I've seen so many people, including myself, that they're eating healthy diets. They're not eating a lot of carbohydrates, but yet when I do their A1C, it's in the pre-diabetic range. If you're pre-diabetic, then it could get worse over time and go from being pre-diabetic to being consistent with type 2 diabetes. And so you want to know what that number is. Your cholesterol, your LDL is the bad, okay? That bad cholesterol number, it should be less than 100. Full disclosure, I just got my blood work recently. Mine's 142, okay? I need it to be lower than that. So I need to make some changes in what I'm eating in order to achieve that, okay? If you have diabetes, then the recommendation is that you take something to lower your cholesterol. I have a lot of patients that have diabetes that they don't really want to take a cholesterol pill. But guess what? Taking a cholesterol lowering medicine, it lowers your risk of heart attacks, strokes, chronic kidney disease, and even dementia. Okay, so some of the dementia that some people have, it is related to their blood pressure not being normal, their diabetes not being fully controlled, their cholesterol not being at goal, in addition to other things like how they're eating, physical activity, their social connections, everything that helps to prevent you from having a heart attack, it will also help to maintain your mind. And that's another thing that all of us want. We want to continue to have a sound mind and be able to live independently where no one else has to take care of us and we can take care of ourselves. And that's what I'm trying to help people do. I want people to live as long as possible so they can take care of themselves, take care of their children, raise their children, and be here. I keep feeling like I want to say amen, even though I ain't at church. But anyway, lifestyle habits, lady. When you go to the doctor, they're also going to screen you for depression and anxiety. If you've gone for wellness exams and they've never asked you about whether or not you are, whether or not you're depressed or anxious, that's something that you should be getting screened for. Just like whether or not you smoke, whether or not you consume alcohol, those things, all of those things play into how well we really are. And, you know, the last thing that is on my list to talk about is just stress. Okay. Stress management, you know, it is so critical in our wellness, ladies, how we deal with stress. Everybody has stress. Everybody, you know, it's something that you just can't afford, but not everybody has the tools that they need to help them to cope when they get a bad diagnosis, when they experience some traumatic event like the loss of a loved one. What I think is most important in terms of stress management is your me time. Okay, so the time that you can be able to take a breath, to get away from maybe the things that are stressing you, to go into your prayer closet, you know, to read some scripture, listen to some relaxing music. Yoga does that for me in part. Getting a massage, you know, taking a break from whatever it is, from the job, you know, from being a caregiver. So many people rely on your village. Okay, I believe that God places people in our life to help us on our life journey, but we have to let them help us. Everybody needs somebody sometime. And if you don't allow the people that God has put in your life to help you cope and deal with life's challenges and trials and tribulations, then you're just doing yourself a disservice. That's why we're here. That I have not only my biological family, but I have a church family. I have a work family. I have a yoga family. I do Zumba in the evening times for my cardio. I have a Zumba family. You know, all of these people, I have patients that are part of my family, right? And so if you let the people that God blesses you with to help you get through your struggles, life is so much sweeter, because that's what we ought to be, right? We should be there for each other, you know, and just being able to recognize that and know when you need help and ask for it. Sometimes, ladies, you have not because you ask not. And
Amen.
again, God, he will send people to help us. God helps us through his disciples. Amen. Right? So he helps us through other people. I feel like God has blessed me with my knowledge and my passion so that I can share that and help other people. And sometimes you may need a professional counselor. You may need a therapist. You may need that person that can be more objective. You know, you can't tell everything to just anybody, right? So you need to have someone that you can share what's on your heart. Keeping it in is not healthy, ladies. It is not. You need to be able to talk to someone, talk it out. So I'm going to stop there. I said a lot. I'm going to open it up for questions. Anybody? Just shout it right on out. I'm looking at the chat now.
Yeah, there's some in the chat, Dr. Feast.
All right. So someone asked, what's the symptoms of this new bird flu? The symptoms of bird flu are very similar to other viruses, okay? You know, regardless of the virus, most viruses, whether it's bird flu, COVID, even measles, you know, you get cold-like symptoms. So the only way to really know if you have a certain virus is if you're tested for it. I mean, you know, several years ago, most of you hadn't heard of RSV. That's something that just came out, right? But all of them can kind of look like a common cold, you know, fever, congestion in your head. A lot of the urgent care providers are telling me that people are coming there thinking they got a sinus infection. They test them for COVID. the COVID comes back positive. So COVID can look like a sinus infection. So can the bird flu, fever, cough, the same types of symptoms with other viruses. What do you take again for the flu that you said? Oh, Tamiflu is the antiviral that you can take if you test positive for influenza A or influenza B. Most people are getting influenza A. Somehow Robin got influenza B. I don't know. But I still took the Tamiflu just on the off chance that it would help me feel better quicker. And the sooner that you take things like Tamiflu for influenza or Paxlovid, which is the antiviral for COVID, the sooner you take it, the more likely it is to help you. So if you've been sick a week and you go to the doctor because you ain't getting well and you test positive for flu, influenza, or COVID, it's unlikely that those antiviral medications are going to be of benefit to you because you've just had it too long for them to help you at that point. That being said, I encourage people to get tested as soon as possible. If you got home tests for COVID, they are pretty much as accurate, if you do them right, as the ones we do in the office. A lot of people don't test for COVID because you don't want to know. It's like a scarlet letter or something. You don't want to know you got COVID. There's some of you out there, you've never tested positive. You still bragging about that. But I tell everybody, it ain't if you get COVID, it's when you get COVID. And most of you probably already had it, that you think you haven't had it. You just didn't get tested during the time that you had the little sniffles because you didn't think you were sick enough to take a COVID test. But that's okay. The other thing that I want to say in terms of just these upper respiratory infections is something that I know all of you have heard before. When you're sick, keep whatever you got at the house. If you coughing your head off or you got a fever, stay home until you get better, if at all possible. If you got to go out, then yeah, it would be nice if you would cover up with a mask so that, you don't give the people around you whatever the infection is that you have. And there are some bad upper respiratory infections that's going around that people are staying sick for several weeks. I had something in October and I coughed for about 6 weeks before my cough went all the way away. And I just kept taking something to help suppress my cough. I know you want to get well yesterday, but sometimes time is what's needed in order for you to get over whatever is ailing you. Is there a cure for diabetes? If a person that has type 2 diabetes, if let's say they are 100 pounds overweight and they're taking medicines for type 2 diabetes, if they lose that weight, then their A1C test that may have been over 6.5 and high, if it goes down below 5.7, then for all intensive purposes, and they're not taking any medicine to keep it down, that's kind of like a cure. They have a normal A1C without taking any medicine to keep it down. So that's thought of like a cure. So people that have had bariatric procedures, gastric bypass surgery, gastric sleeve, and they lose weight and they had diabetes or a high A1C before, but they lost 50 plus pounds and now their A1C is normal, they're thought to be cured. So sometimes enough weight loss can get you a normal A1C, and for all intensive purposes, that's like a cure. Obviously you have to maintain the weight loss. And if that's something that you are doing without any medications, without these weekly drugs or anything else, then you can consider that a cure. What else do I see? Help me, Carol, in case I'm missing something. So someone is saying that their cholesterol number is 150, and the doctor is saying that's not good. What I would say is that depending on how old you are and whether or not you take high blood pressure medicine or you have diabetes, then 150 probably isn't good for an LDL cholesterol. For a total cholesterol, the goal is less than 200. So I think 150 is good for a total cholesterol, but for the LDL, which is the bad, the goal is less than 100. I mean, and I've seen patients that have had heart attacks that have had an LDL in the 150s, so I don't know who is going to have early heart disease, what I know is the things that can help prevent people or postpone that heart attack or that stroke or that chronic kidney disease. And it's controlling these chronic long-term problems. Those are not smoking, quitting smoking. One of the things that recently came out that I wanted to share because it hits home with me is that at the beginning of the year, they talked about how even moderate alcohol consumption is a cancer risk factor. And that was the other thing that I wanted to make sure that I mentioned too, is cancer screening, ladies. But alcohol, you know, drinking a glass of red wine, traditionally or in the past, that has been thought to have cardiovascular benefit. Now, I mean, over time, things change. Even a couple of glasses of wine, if you're doing that every day, is considered a risk factor for cancer, particularly certain cancers like breast cancer, colon cancer. I was one of those people. You know, I come home at the end of my day and pour a glass of red wine, and I didn't feel convicted spiritually about it. But I recently had a 40-day fast, and, you know, the Holy Spirit spoke to me and said, you know, Robin, so, you know, my grace ain't sufficient to calm your stress down at the end of the day. You got to have a glass of red wine. Really? So I'm not enough, right? My word ain't enough. I'm not enough. And so I was convicted in a way that I have never been in my life. And, you know, I haven't had any alcohol since January the 6th. And I'm not saying I'm never going to drink any alcohol again, but I'm never going to be a person that is coming home at the end of every day and consuming alcohol, because it is just not a healthy habit. And one of the things that I strive to do is anything that I'm asking of patients, I'm subscribing to that myself. And so I wouldn't want my patients to be going home drinking alcohol at the end of every day, and I'm not going to do that anymore either. So cancer screening, before I run out of time, I want to make sure that you know that cervical cancer screening, it's between 21 and 65 years old in general. It no longer is, you know, if a young woman is sexually active before the age of 21, we're screening her for sexually transmitted infections. But the first pap smear is not until the age of 21, unless there's something, you know, else happening with that young woman. We wait until the age of 21. And at 65, if you've had normal pap smears, then you talk to your healthcare provider. We generally stop putting women through pap smears at the age of 65. Cervical cancer is considered a sexually transmitted disease in that it is the HPV virus that is sexually transmitted that tends to lead to cervical cancer. And so for women that are over 30, a lot of times we are not only doing a pap smear, but we're testing for the HPV virus. And depending on whether or not that is positive, that kind of weighs into when you'll need your next pap smear. So a lot of women, you can stop cervical cancer screening or pap smears at the age of 65. This is Colon Cancer Awareness Month. I would be remiss if I didn't mention colon cancer screening. I just talked to my church on Sunday about how 45 is the new 50. In the past, it was 50 that we'd start screening people for colon cancer. It has been lowered to 45. If you have a family history, it may be lower than that. But 45 is when your doctor should be talking to you about colon cancer screening. And if you are 45 or older and your provider has not mentioned it, then you need to bring up the conversation. You need to say, doctor, I think I need colon cancer screening. Can we talk about that? Okay. Breast cancer screening. I screen women starting at the age of 40. And, you know, there was a guideline that talked about 50 a while back. I never did that. Okay. It has been 40, and it may be younger than 40 if you have a family history of breast cancer. So you should talk to your provider about whether, if you're younger, if you have breast cancer in your family, a sibling, a mother, you should talk to them about when is it age appropriate for you to get a mammogram to screen you. And let me just say, if you are otherwise healthy, even if you are 76 years old or 77 years old, and I can see you living another 10 years, I'm still sending you for a mammogram. Okay. When my mom went to her doctor a while back, And I asked her when was her mammogram. She said, well, the doctor told me that I didn't need one. My response was, well, did you tell her that you wanted one? And she said no, because she said I didn't need one. Well, I wanted her to have one because I've seen too many women in their late 70s that have been diagnosed with a small breast cancer. They have the lump taken out. They don't need radiation. They don't need chemotherapy. They go home and they keep on living their lives. The older we get, the more likely we are to get breast cancer, ladies. And so if you're otherwise healthy, the mammogram is still covered. If Medicare stopped paying for it or the insurance has stopped paying for it, that'd be one thing, but they still paying for it. So as long as they pay for it, I'm encouraging women to continue to go once a year and get their mammogram. And I encourage them to go every year, because guess what? The radiologist is human. They might not see a little something on that mammogram this year. And if you wait 2 years, then that just allows it to grow, and it may get outside the breast and makes it harder to treat. Okay. Lung cancer screening. Any of you all that are smokers, that you've been smoking a pack of cigarettes for 20 years plus, and your doctor has not said anything to you about lung cancer screening, then you need to ask them. If you quit smoking within the last 15 years, you need to ask them about lung cancer screening, because most payers will cover that as a preventative test, and we are not offering it enough to our patients that are former smokers that they've quit within the last 15 years, and for patients that are still smoking. By the time you cough up some blood or you short of breath, that lung cancer likely has spread outside that lung. And so the purpose of screening is to catch it before it spreads, to catch it early, so that the treatment will work better and your outcome will be longer. We ain't staying here forever. I'm trying to help people live and be well as long as possible. The last cancer screening that I want to mention is prostate cancer screening. It is very controversial. And I know that this is a women's webinar, but guess what? All of us have men in our lives that we love, and we want them to live as much as possible. And so any of you ladies who are connected to a man, tell them to talk to their medical provider about, is it appropriate for them to get prostate cancer screening. The prostate cancer screening blood test, it's a screening test. In order to get diagnosed with prostate cancer, you got to have a biopsy of the prostate. It is not something that is comfortable for male patients, and men may opt out, may opt to not do that. But I want every man to have the conversation with their doctors. And unfortunately, not all medical providers are even bringing it up because it's so controversial. It's our job to bring it up, but sometimes we don't always discuss everything as primary care providers that we should. Because guess what? None of us are perfect. The time is limited. That 15, 20-minute visit, it's a lot of stuff to unpack, particularly if you have other problems that's taking up a lot of that time. So.
Dr. Page, there was a question. My question was, is there a vaccine for measles?
Yes, there is. And it is the best way to combat measles. Yes, there is a vaccine. I mean, we immunize, or we try to immunize children for measles. The first one is initiated between 12 and 15 months of age. And then the second one is before kids go to school, between like 4 and 6 years old. So yes, there is a vaccine for measles. Unfortunately, there are a lot of parents that feel they've read something about how there's an association with measles and autism. That really hasn't been proven to be the case. Autism tends to show up at the same age as when kids get their measles vaccine. And so, as a parent, I can understand that if my child gets their first measles vaccine, and then a year after that or 6 months after that, they get diagnosed with autism, that I'm thinking that it could have been the shot. But just because that happens like that, it doesn't necessarily mean that it was a vaccine. And again, all vaccines have potential side effects and things that can happen. But there have been 2 children that died from the measles, within the last year or so. And so, it is something. I'd rather my kid, I don't know how I can live with that if my kid died from measles and I didn't get them the measles vaccine because of something that I heard somebody else say, as opposed to listening to the pediatrician or the medical provider. I hope and pray that my patients trust me. I certainly try to keep myself educated so that that my patients trust me and my medical opinion. I would hope that they would trust me more than they would trust somebody that they see on YouTube, because that ain't the person that's going to be taking care of them when they get sick. Maybe I shouldn't have said that, but
There's
kind
nothing
of how I
wrong.
feel.
Are you accepting new patients?
I am officially not accepting new patients, but I do at times accept new patients, particularly the ones that are connected to people that I already see. But I'm not officially right now. That may change at some point during this year. So, check back with me. And my office is primary care clinic at the Oaks. I'm a UNC Provider Network provider, so I'm employed by UNC Provider Network, even though my office is right here in Lumberton. And so, yeah, there are times that I accept new patients. I'm not going to just flat out say I don't, but there are times. What else do we have? How do you know when you have shingles? Shingles, it's a rash. Usually when people hurt, they get the pain from shingle before the rash breaks out. Okay. And so sometimes people will have a pain on their side. They'll go to the doctor. They say, I'm hurting so bad right here, but there's no rash. And the doctor may treat them with, ibuprofen or something. They think they pulled a muscle. And then 2 or 3 days later, they get these vesicles. They like water bumps. And then it's red up under these little vesicles. That's what shingles looks like. And it's in a nerve. That's why it hurts so bad. And so it can be like a line of it. You can see it like going around. Or, some people get it in their facial nerve, and it can affect the vision in your eye on that side. I got patients that can't hear good out of the ear on the side of their head that they got shingles. So it's not something that you want to get. We all should, over 50, we should be getting our shingles vaccine. I'm talking to myself as well as y'all. Are all GLP medications the same? No, they're not the same. Wegovy and Ozempic are the same, and Mounjaro and Zepbound are the same. But Mounjaro, Zepbound, they tend to work a little better in terms of how well they control the diabetes, the weight loss that is seen, and the I just totally lost my train of thought. The side effects. So Mounjaro, Zepbound tend to be better tolerated than Wegovy, Ozempic. And I said better for the diabetes, but all the drugs are very good at controlling type 2 diabetes. I take that back. I think Ozempic is just as good as getting my patients A1C below 6.5 as Mounjaro. But, the weight loss with the studies is a little more with Mounjaro or Zepbound. And Zepbound just recently got an indication for obstructive sleep apnea. So for those of you that's on CPAP for sleep apnea and you're overweight and you're wanting to maybe try to get one of these drugs to help you lose weight, Zepbound has an indication for obstructive sleep apnea. The other thing about these drugs, ladies, is usually if you start taking it, you lose some weight, 20, 30, 40 pounds, and you stop taking it, you find that weight. It comes back, okay? Because a lot of people that take it, it changes their metabolism. So when you stop taking it, your metabolism goes back to what it was before you started taking it, and then the weight comes back. Mm-hmm. Cancer prevention, early detection. Early detection does save lives. Definitely. The sooner you find out you have it, the better your outcome. Do you know of anyone shadowing for pediatric care? I think there's a pediatrician that is in Robinson County named Katie Lowry. Dr. Lowry, she's in private practice. Love her to death. So that might be one that you can look into calling her up. She has shadowed one of my church members in the past. In my old age, should I get measles shot again? Probably not, I would say, unless, you're going out of the country to somewhere that they got a lot of measles. I would say no. Also, what is your opinion on taking a gap year after college before going to medical school? I think that's fine, but I would say you make sure that year is meaningful. Okay. Things that I would suggest to you to maybe consider doing if you took that gap year before going to medical school is doing a medical mission trip. I went to Africa a couple times. I went to Tanzania and Malawi. If I had done that before I went to medical school, it would have totally changed my trajectory of my career. I may have been a medical missionary, because going to a place where it's underdeveloped, it's like, the world just started there. It changed me. It changed. I never thought I could be more grateful. But when I went to an underdeveloped country, I was more grateful to be born in a developed country. I mean, I think many of us just haven't thought about that have never seen or been to an underdeveloped country. Or maybe even shadowing someone during that gap year. For the young woman that asked me about that. Is there a challenge with insurance to switch from one to another? Is there a challenge with insurance? Sometimes, I guess if you are wanting to switch with a different insurance, it is challenging. If you're switching, the two most important things you need to consider if you're going to switch your medical insurance, you need to make sure that you can still go to the doctor that you want to see. Okay, because I got patients, they switch, and whatever they switch to, I'm not in the network. Okay, and you need to make sure that the medications that you take are going to be on the prescription drug plan of that insurance. That's so important. Do you know anything about CMOS? Or I've heard people, and I've actually used the CMOS, this Rise coffee tea. I've not used that, but these types of things, I'm all for them. Okay, I'm all for mushroom coffee and these different coffees, and if they have medicinal benefits, as long as it's something that's not harming someone, then it is not something that I'm going to tell you not to do. I want you to try natural things as opposed to necessarily taking a prescription drug. But if it doesn't work, okay, if it is not lowering your blood pressure to a normal level, if your A1C is not controlled or your cholesterol is not controlled, then you need to look for something else to get your numbers under control to reduce your risk of having a heart attack or a stroke. This person says, my gallbladder has been removed. Should that be a concern to me in any way? I would say no. My gallbladder has also been removed. For some people, when they have the gallbladder removed, it can affect their bowel habits. Some people have more loose stools. Others do not. But you don't need a gallbladder to live a full and healthy life. Sometimes those weight loss drugs can unveil the fact that you have gallstones and lead to you having an inflamed gallbladder. And there have been patients that they had to get their gallbladder taken out because they had an acute gallbladder attack in the setting of being on one of these weak drugs that are used to treat diabetes and overweight. It's after 8 o'clock, ladies. I don't want to overstay my welcome. I see someone saying something about Trulicity. Trulicity is another weekly shot that is used to treat type 2 diabetes. Some insurance companies want you to use Trulicity before they'll consider paying for Ozempic or Mounjaro. If it's controlling your diabetes and you're tolerating it, it's all good. If you are wanting to get some weight loss and Trulicity is not affording that, then you might ask your doctor about switching you to Ozempic or Mounjaro to see if your insurance will cover that, because they are more associated with weight loss than Trulicity is, in my experience.
Dr. Peace, there was one last question. When is insurance open season? That was from the live.
Yeah, I mean, it's normally like October. It starts in October and goes through like the first of the year. But, I can't say that I have those dates committed to men. But, we can ask Siri to tell us that. But it's usually like, October is open season when you can change your insurance. But having the right health insurance on a last note is one of the most important things that you can do for your health and well-being, so that you can have access to health care. Okay. And full access. I mean, there are alternatives for people that have a job that don't have insurance, but that should be on your list of priorities, is to have very good health insurance. You don't want to skimp on your health insurance. So the premium is not always the best health insurance for you. Saving $100 is not always in the long run going to be the best thing. For people that have Medicare, if you don't have a prescription drug plan or a Part D as in dog plan, you need to get one, because you are likely going to need a prescription drug that is not a generic, and it is going to be too expensive without having a prescription drug plan to help bring down that cost. So it's just so important. But, just ending it, I hope that something has been said this evening, ladies, that will help you make healthier choices so that you can live long and full lives, and be here for the people that love you. We all have someone prayerfully that, need for us to live. One of the things that convicted me about my alcohol at the end of the day, even if it's just a couple of glasses of wine, is I'm trying to live as long as I can so that I can continue to serve, be there for the people that call me their doctor, be able to take care of my mama if she needs me, if she gets sick. I need to be alive in order to do that. I need to be alive and well in order to be there for the people that's counting on me. And I know that many of you in your lives, all your lives have value. Don't let the enemy tell you that it doesn't. I believe everybody's life has value. Sometimes as we get older, we feel like our value diminishes it, but I rebuke the enemy that would make you believe that your life still don't have value.
That's right.
How old you are, I don't care what your medical conditions are, your life still has value. The kingdom of God still needs you, can use you. So you might have a pity party about whatever's going on, but don't you stay there, because God is still good. God is faithful, and
Yes.
God can deliver you out of any situation, any illness that you have. You trust God. Okay. I want you to have a doctor that you trust, but first and foremost, I need for you to trust God. You trust God. Hello. Me or your doctor. You pray. You trust God.
That's
and
right.
best to take care of yourself so you can live as long
Yes.
Dr. Peace, you're my best doctor. Love you.
Love y'all.
Love you.
Amen. Thank you so much, Dr.
Amen.
Peace.
Bravo.
This was absolutely amazing. And you see why she got the title Preacher of Health, right? She was just preaching to us, right? About to
Yes.
go to church.
Yes, she
But
preached.
thank you so much, guys, for joining us tonight. And Dr. Peace, thank you so much once again, always. I'm gonna turn it over to Madam President to close us out.
That was so amazing. So much great information. I couldn't keep up between the questions here and the questions online. I want to thank everyone who was on our live chat watching. They got some wonderful information, got some great feedback as well. And as usual, you always come. This is your second time with us. And like I told you last year, you told us about the app, scan the food and see if it's good. My mom been scanning it. Seems like I can't bring nothing in the house. We can't eat anything. Everything is banged. Got to throw everything out the refrigerator. I thank you for it. And this was very, very helpful. Thank everyone who came on. Please make sure that you are one. Let me thank our health initiative team for doing this. Carol is one of our members, and we have Sister Shamari Shu. She wasn't able to make it, but she is our chair. Felicia Williams is on another meeting. She's our co-chair. and Miss Queen, they've been really working hard to make sure that we get information out about health equity within our community. And if you would like to join our team and join our organization, you're more than welcome to find us here in Fayetteville Area Section. You can find us on Facebook. You can connect with me as well. Carol is our correspondent secretary, and we have some other members that's on. Thank you, Miss Rosemary, for coming in. Thank Miss Mary Highsmith, I saw. Miss Dudley, we got Teresa Wright, who's a part of the Cape Fear. She's also a nurse as well. So I know she was probably writing some things and taking it back. Got Sister Sheila that's on. But thank you all for coming. Next month is April, and April is our financial literacy month. Not only are we going to talk about our physical health, but we want to talk about our financial health as well. And so next month we will be having our financial literacy week. We will be talking about budgeting, talking about home ownership. We're going to be talking, working with kids on how to start their own businesses, entrepreneurship, because we know that right now we are in a time, we don't know what's going to happen in these 4 years, and we are in a time. So it's time for us to work on our finances, saving money, because we just don't know what's coming about. But please make sure that you can connect with us. You can connect with myself, Fayetteville Area Section, ncnw@gmail.com. Again, if you know Carol, contact her if you want to be a part of this organization. Thank you again for coming, Dr. Peace. I don't know what else to say, but we're looking for you to come back again. And I'll be honest with you, what happened to my Facebook page, I'm so mad because my old Facebook page that we was on got deleted and things. And so the webinar that you did the first time, I lost it. So I said, we have to get her back. We have to get this back. So I'm going to put this on our YouTube channel as soon as I get off of here. And thank you again. Peace be unto you, and I thank you all for joining us. Thank you so much, and we'll see you the next
Good
time.
night. Yeah.
Good night.
Good night, ladies.
Good night.
Thank you, my sweet cousin.
You're welcome, my sweet cousin.
Oh.
Good night.
Take a